Africa is facing a debt crisis. It's a problem that's been building for decades and it's getting worse. Countries are borrowing more and more money, but they're struggling to repay it. This is putting a huge strain on their economies and is having a devastating impact on the lives of ordinary people. We're talking about basic services like healthcare and education. These are the things that people rely on to live healthy and productive lives. But when countries are drowning in debt, they have to cut back on these essential services. That means people are getting sicker, kids are missing out on school, and the cycle of poverty continues. This isn't just an African problem, it's a global problem. The international community needs to step up and do more to help African countries get out of debt. We need to find sustainable solutions that will allow these countries to grow their economies and provide for their people. It's time to stop kicking the can down the road. We need to act now before it's too late. ActionAid, an international development charity, has been sounding the alarm about Africa's debt crisis for years. Their persistent efforts aim to bring global attention to the dire financial straits many African nations find themselves in. Their latest report, 50 Years of Failure, the IMF, Debt and Austerity in Africa, paints a bleak picture. This comprehensive document delves into the historical context and the ongoing repercussions of financial policies imposed by international bodies. The report argues that the International Monetary Fund, or IMF, has been pushing austerity measures on African countries for decades, and these measures have actually made the debt crisis worse. The data presented is compelling, showing a clear correlation between IMF policies and worsening economic conditions. Austerity is basically a fancy word for cutting spending. It involves reducing government expenditures in an attempt to balance budgets and reduce debt. When the IMF tells a country to implement austerity measures, it means cutting back on things like healthcare, education, and social safety nets. These are critical services that directly impact the well-being of the population. The idea is that this will free up money to pay back debts. However, the reality is often starkly different. But in reality, it often just makes things worse. The economic downturns that follow austerity measures can be severe, leading to prolonged periods of hardship. When you cut spending on essential services, people suffer. The most vulnerable populations are hit the hardest, exacerbating existing inequalities. They get sicker, they can't afford to send their kids to school, and they're more likely to fall into poverty. The cycle of poverty becomes harder to break, trapping generations in a struggle for survival. This, in turn, can lead to social unrest and instability. When people are pushed to the brink, the social fabric begins to fray, leading to protests and sometimes even conflict. So, while austerity might seem like a good idea on paper, it often backfires spectacularly. The intended economic stability is rarely achieved, and the social costs are immense. ActionAid's report is a wake-up call. It urges policymakers and international financial institutions to reconsider their approach. We need to rethink the way we address debt in Africa. Sustainable and inclusive economic policies are essential for long-term growth. Austerity is not the answer. The evidence is clear that it leads to more harm than good. We need to find solutions that will help countries grow their economies and provide for their people without plunging them further into debt. This means investing in public services, fostering economic diversification, and ensuring that financial aid is used effectively to build resilient economies. Let's talk about the real-world impact of austerity. When governments are forced to cut spending, one of the first places they look is public services. That means hospitals, schools, and social welfare programs all get hit hard. And who suffers the most? You guessed it, that's it. The most vulnerable members of society. Imagine you're a parent in a country struggling with debt. You're already struggling to put food on the table. Now, imagine the local clinic has to close because of budget cuts. Your child gets sick and you can't afford private health care. What do? This is the reality for millions of people across Africa. Austerity measures are literally costing lives. They're denying people access to essential health care, education, and other vital services. It's a moral outrage, and it's time for it to stop. We need to invest in public services, not cut them. Strong public services are the foundation of a healthy and prosperous society. By investing in healthcare, education, and social welfare, we can create a more just and equitable world for everyone.
Section 4. Voices from the Ground, Stories of Struggle and Resilience. This section delves deep into the heart of the matter, bringing forth the voices of those who are often unheard. ActionAid's report doesn't just rely on statistics and economic jargon. It goes beyond the numbers to paint a vivid picture of the human experience. It also features powerful testimonies from people living on the front lines of the debt crisis. These are real stories from real people, sharing their struggles and hopes. These are the stories of nurses working tirelessly in understaffed hospitals, teachers struggling to educate children in overcrowded classrooms, and families struggling to make ends meet. Each story is a testament to their resilience and determination. In Ghana, a nurse named Abina describes the impossible choices she has to make every day. Her story is one of many that highlight the dire situation faced by healthcare workers. With limited resources and staff, she's forced to prioritize patients, knowing that some will inevitably miss out on life-saving treatment. The weight of these decisions is a heavy burden to bear. It's heartbreaking, she says, but what else can we do? Her words echo the sentiments of many frontline workers who are doing their best in impossible situations.
In Kenya, a teacher named Joseph talks about the impact of overcrowded classrooms on his students' education. His passion for teaching is evident, but so are the challenges he faces. With more than 60 students crammed into a space designed for 40, it's impossible to give each child the individual attention they need. The overcrowded conditions make effective teaching a daunting task. We're failing these kids, he says, and it's not fair. His frustration is palpable, and his dedication to his students is unwavering.
Section 5. The unequal burden. How austerity disproportionately impacts women. Here's a harsh reality. When it comes to austerity, women bear the brunt of the burden. This isn't just a minor inconvenience. It's a significant issue that affects millions of lives. Why? Because women are disproportionately represented in low-paying jobs. They're more likely to be responsible for unpaid care work, and they often lack access to essential services. Think about it. These roles are undervalued and underpaid, yet they are crucial for the functioning of our society. When governments cut back on healthcare, it's women who are most likely to miss out on vital maternal and reproductive health services. This can have long-term consequences on their health and well-being. When schools close, it's often girls who are forced to drop out to help with household chores or care for younger siblings. This disrupts their education and limits their future opportunities. And when social safety nets are slashed, it's women who are most likely to fall into poverty. These cuts can mean the difference between having a safety net and falling through the cracks. Austerity policies exacerbate existing gender inequalities, pushing women further to the margins of society. This marginalization can lead to a cycle of poverty and exclusion that is hard to break. We need to recognize this gendered impact and develop solutions that prioritize the needs of women and girls. This isn't just about fairness, it's about creating a more just and equitable society. This means investing in quality public services, promoting women's economic empowerment, and ensuring that women have an equal voice in decision-making processes. Their perspectives are crucial for creating policies that work for everyone. We can't talk about solving the debt crisis without addressing the needs of half the population. Women are not just passive victims. They are active agents of change who deserve to be heard and supported.